Okay. Let's go ahead and get started. Can you go ahead and shift to the next slide, Marty? Okay, who's calling this meeting to order? Remind me. Which
Oh, I guess I should go. I'll go back to that one.
It's Hannah. Hannah is calling the meeting.
Thank you. Hannah, you get to call the meeting to order and then we'll do the land acknowledgement.
Perfect. All right. This is the Justice Project Oversight and Planning Committee meeting on March 20th, 2025 at 2:03. I call this meeting to order.
Thank you.
Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semi-Emu people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events.
Thank you. Okay, so I'm just wondering, well, let's start with the logistics anyway. So you guys know the drill here. Keep your video on, keep yourself muted except when speaking. Of course, we're recording these because we're in open public meetings. Use your raise hand button to be recognized to speak. And when you use acronyms, try and remember to define what they mean. Just a reminder too that if you are not a member of the JPOP, then if you could just hold your comments until the very end, you can take notes if you like, but then you'll have your opportunity to speak at the very end of the meeting. Okay, so we'll go through now the agenda. First off,
Sorry.
Yeah.
There you are.
Do we have our two newest members here?
Well, we have Parneet, who is here. So glad you joined.
Great. Parneet, do you want to introduce yourself?
Hi, everybody. My name is Praneeth Kaur. I go by she, her pronouns, and I recently got appointed to fill the youth vacancy in the JPOP committee. So thank you for having me, and excuse me for my absence in the past meeting. I'm ready to engage. Thank you.
Really glad you could make it. That's great. And then is William here?
Well, there's somebody with just a phone number that's 360-223-6015. Is that, who is that? Baby William?
Okay.
Well, I'm not sure. So I don't see him anyway, but I'll let you know if he comes on.
Okay. So William Lucero is potentially, hopefully going to be our new representative from the Lummi Nation. So hopefully he'll be able to join us soon, if not today, at the next meeting. Okay, so we're going to start today with the action plan review, and that just helps us stay on track with our plan. And then we'll turn it over to Julia from Village Reach, and we'll take the next step in the Justice Project Performance Measurement Plan. So if you remember from our last meeting, we talked about the definitions of success, pulling from the previous work in the needs assessment and the implementation plan, and then just some awesome conversations and really dialing in what makes sense today. And it was so good. We caught so many important things. So Julia has incorporated those, and we're going to take a look at those and then spend the most of our time, however, looking at these draft outcome measures that she's put together for us to start to discuss. So that's the bulk of our meeting. Then we will hear just some brief updates on the JLBCC design and stakeholder engagement and some feedback on the communications. We're still working on that so that, the public and all of the different representatives from different agencies in our community and the council, everybody can really know where we're at with this thing. And then the exciting moment where we might actually see each other in person on April 17th. So we'll just touch on that briefly and close out with some public comment. So any comments on the agenda? Any questions? Okay, great. Go ahead, Marty.
Okay, so this is our little orientation to where we are today, March 20th. This is our 6th meeting as a group. And we are really in the midst of the performance measurement plan, as Holly described, and so excited to be working with Julia on that. And the other topics we've already gone through, we will talk about those today. And then coming up, we are going to continue our focus on the performance measurement plan, adding in the stakeholder engagement opportunities, particularly with jail inmates and public engagement around the jail design and behavioral care center design. Also, at moving forward, starting in April, we are going to contribute to the Incarceration Prevention and Reduction Task Force's annual report, which is due in June. All of the IPRTF committees contribute to the annual report. So we will be talking about that at our next meeting. Then we will review a draft at the May meeting, and then the report will be finalized by the IPRTF in June. So that's our plan moving forward. And now I'm gonna just pass it over to Julia.
Great, thank you, Marty. Let me go ahead and share my screen. Okay. It'll take a moment to load there, but as it is doing that, I just wanted to quickly reiterate what Holly shared in terms of a big thank you to everyone who's able to join last meeting and give a lot of really great detailed feedback on the definitions of success. As I'm going through this, and I'm sharing screen, I won't be able to see the raised hands, but Marty, if you can let me know if folks have their hands raised, as we will have a couple of opportunities for folks to give input or comment on the content. So starting off with this slide is just to all get us up to speed on where we're at, as I know some people are new and also not everyone has been able to attend every meeting. And so this is just a kind of zoom out and context setting for the session that we're about to have together. So on the left-hand side, we start with the Justice Project Implementation Plan, which employs 5 strategies. So you can see those 5 strategies there. And then we have key stakeholders that are implementing 15 activities that, are in alignment with those 5 strategies. And so all of that is to reach these definitions of success, which we discussed last time at the February JPOP meeting. And then if we are to reach these definitions of success, what outcomes would be created as a result? And so we today will review the improvements or changes to the definitions of success, and then we will move on to discuss, okay, what are the outcome measures? And we have some suggested ones, and we'll solicit feedback as well as hear if there are any that are missing. So with that, I will go ahead and get us into the updated definitions of success. We're not going to spend a ton of time on this piece, as I really want the bulk of the session with you all today to be focused on the outcome measures, but we wanted to get everyone on the same page in terms of recalling what the definitions of success are and show you the updates to it. And there are more details in the packet that Marty sent out to really see kind of the whole progression from the original definition, the feedback received, and the changes. We will just be focusing on the updated versions. I will go through 4 slides that have the updated definitions of success at the different levels. So process level, systems level, service level, and facility level. And then we will open up the floor for any high level kind of comments, anything that might strike you as like, oh, this is wrong, or this is really clearly missing. We're not going to do any kind of the nuanced wordsmithing that we did last time. So just wanted to set that expectation. Okay, so getting started, what we are defining success at the operation and/or process level is that success looks like practicing wise stewardship of public resources by using evidence-based decision-making. It looks like consistently gathering reliable data from across the criminal legal system and community services to monitor and evaluate system performance. And I'll just note that when you see this change in color, that is an addition that we have made based on the feedback we received from you all at the last meeting.
Yeah, can I just interject here too? So she's got 5 slides here with this edited language. So we're going to go through all 5. And so if you see something, just jot it down. Okay? Keep going.
Yep. And it's 4 slides, just so that you're tracking. Yeah. So success looks like facilitating public engagement and transparent decision-making processes that reflect community priorities. It looks like ensuring systems, services, and facilities are adaptable to changing circumstances and needs. And it looks like openly and actively addressing inequities and discrimination. At the systems level, success looks like policies being identified and changed to strategically address system gaps and achieve intended outcomes, such as reducing the jail population. It looks like people being assured a speedy and fair resolution of legal issues to reduce unnecessarily long jail stays or other legal complications and hassle restoration. It looks like low-risk offenders being safely and effectively diverted from the criminal legal system at each intercept of the sequential intercept model. So that includes community services, law enforcement, initial detention or court hearing, jail and courts, reentry, and post-incarceration community supports. It looks like the risk assessment process successfully identifying low-risk offenders and connecting individuals to the appropriate programs. It looks like sufficient funding, staffing, and resources, ensuring adequate service capacity at all points of contact in the criminal legal system. And it looks like Medicaid funds covering behavioral health services provided during incarceration and through the process of community reentry to ensure a seamless transition from jail to community services. At the service level, success is defined as coordinated services and programs are effectively closing the gaps between the community, legal, and jail-based services at all points of contact in the criminal legal system. Success looks like planning for release beginning early in an individual's period of incarceration so that upon release, they have timely access to behavioral health and medical care, housing, employment, transportation, and support systems to avoid reincarceration. It looks like community and jail-based services supporting healing and making measurable differences in reducing crimes of poverty and repeat offenses. And then it looks like there being sufficient behavioral health workforce to address county needs, including a pipeline of new workers entering the field and retention of the current workforce. And then finally, at the facility level, success is defined as facilities being designed and operated to meet the health, safety, and welfare needs of those incarcerated and the people who work and visit there. It looks like facilities being designed to be versatile to adapt to changing needs. It also looks like incarceration facilities balancing compassion with accountability to promote safety, health, rehabilitation, and recovery. And finally, it looks like facilities adequately serving the whole county, including cities and tribal jurisdictions. So I will pause here and see if there's any input from folks on the call on anything around, is anything to you majorly missing? Is anything seem wrong? Any high level inputs or reactions to these updated definitions of success?
Tasha?
I think it was one slide back. When you say crimes of poverty, is that defined somewhere and I've just missed it? It just struck me as I'm not sure what that specifically refers to.
Yeah, so that's coming from the needs assessment and then what's reflected in the implementation plan. I don't know if Marty or Holly, as you were kind of involved in the initial writing of that, if either of you want to chime in there. But we can pull a definition and circulate that with folks to make that clear.
It's a great question, Tasha. I don't know that I don't remember that it was pulled out as a specific and specifically defined, but we can look in the doc and see if it was. Or make sure that we do define it.
Well, I just, to measure it, I was like, well, what crimes qualify as that? So we know what we're trying to measure.
Yeah.
Sure. Definitely. We'll need to get into that when we're talking about the concrete measurements for sure.
Okay, what else? Anything else? Do you like them? Are they sounding more accurate?
This is Rob. I think they sound more accurate. I would agree with Tasha's point of just defining that, but I think other than that, they're certainly a lot more accurate and a lot more focused on what we're trying to do.
Thank you. Tasha, did you have another comment?
Yeah, when it says this is a new one, so I'm just trying to confirm I understand what we're saying. So the bottom line, sufficient behavioral health workplace, including a pipeline of new workers entering the field. What does that mean?
Yeah.
Like we creating a program to train? I'm just wondering what that meant.
So that is coming from feedback we received that on this point around how we're seeing less people entering into the behavioral health workforce within Whatcom County, and then also, the retention piece. So I think it was Hannah Sloan that commented that. So I can let her, if she wants to speak to if there is anything specifically that is being done to build out this pipeline of new workers. Because the project generally is to address those behavioral health workforce shortages, and it can have multiple elements that go into that. So Hannah, I believe you're on the line, and I believe this comment came from you. If you have anything to add around that pipeline piece in terms of more nuanced details.
I don't know. I mean, like we have some programs at Western and Whatcom Community College that could potentially be just direct pipelines. Yeah, I'm not sure.
In the quarterly update reports, the kind of work that is going on to try to address this need for more behavioral health, a larger behavioral health workforce is meetings between the 3 higher education institutions in our community to try to be really coordinated in what the curriculum is, what curricula are being offered, and having those align with the needs of organizations that would hire people straight out of school, and also getting internship programs that feed from those colleges, the college and the university, to local organizations, that then those people who have had an internship would be hired. So it's just trying to grow our population of people who would be qualified to serve in the positions that need to be filled here in Wacom.
Is the issue, Tasha, just the term pipeline is feeling a little,
Well, so when I'm looking at this, we're always trying to create metrics to measure success. So that to me is just such a broad term. I didn't know what I honestly was like, well, what's that? Like, I almost read it as, are we creating our own program to do something? Are we paying for training behavioral health? Is that part of it? Is that gonna kind of incorporate that into this? So I just was like, what does that mean? I just kind of wanted to define what that means so that we know how we're measuring whether being successful in doing it.
Yeah, and so that's something that I am chatting with, on this around workforce specifically. I've chatted with Melora Christensen around what are some of the metrics that would go into this. So that is, as someone who's very data oriented, I appreciate all of your questions, Tasha, and is something I just want to say that like is being discussed and looked at in terms of how we actually measure this. We won't be able to get into that nitty gritty on this level of call, but we are kind of digging into what that actually looks like and how we're measuring it.
and I think that we won't solve all this, but from everybody, if you see, I just don't know what that means, this is a fine time to flag that, whether or not we resolve it today, so we can make sure that these are clear enough that people in general can understand them. And Miriam, I see your hand. You're up. I can't hear you though. I don't see you're muted, but I can't hear anything right now. And we'll take about just 5 more minutes or so on this because we want to make sure we have time for the measures. So if they're in the light of day, I mean, first of all, just if we can hear them all, that'd be great. But also, if you think of something or notice something after the meeting, email Marty and we'll pass it on to Julia and we'll just see if we can catch those.
Mm-hmm.
Okay, while Miriam's working on her sound, anybody else have a comment on something they're noticing? Okay,
Hello?
Miriam, yes, and then Hannah will take you next. Go ahead.
Oh, cool. Yay. All
Okay.
right. So my questions were similar to Tasha's around definitions of specific things. And around that, really, I had questions like on the facilities are designed to be versatile, to adapt to changing needs. The question really is who determines what those needs are and what constitutes a changing circumstance, and if those could center the community facilities are supposed to serve primarily. I think that could be a good response to kind of like, okay, so whose needs are we actually pivoting from, if that makes sense.
Yeah, definitely. And then did you have another? You said you had a couple.
It's around the definitions and making sure that when we say needs, we look to the people we're serving.
Yeah. The changing needs of the people we're serving.
And being very explicit about that.
Yeah.
As a success.
Great feedback. Okay. Hannah, did you have a comment?
I was just gonna go back to the workforce point and maybe provide some more insight as to what this all encompasses. I think the pipeline piece is a little bit tricky for me at least, because it is hard. How do you get a direct pipeline and make sure that that's continuing for years to come? But also, I think the biggest issue is getting people to enter the community behavioral health workforce and retaining that workforce, because we're not paying people as much as private practice is going to pay them. And so how do we kind of supplement those reimbursement rates from Medicaid and state insurance with other funding to make sure that people see that they're valued and don't just jump ship and go to some place that will support the high cost of living that Bellingham has.
Got it. Yeah, so it's like getting more people attracted or engaged in the work, getting them trained, and then retaining them. So retaining of the workforce. Okay, anything else? And Miriam, I wasn't sure that we got all of yours. Did you have any others?
They pertain to some of the next conversation, so I want to make sure we have time for those.
Right on. Yeah, I think in some ways the outcome measures will help us do that better definition, right? Or more concrete.
Yeah.
Okay, are you guys ready? Should we move on to the outcome measures? Okay, let's do it.
Great.
Julie, I'm so excited. It's gonna be great.
Awesome. Well, great. I'm looking forward to this conversation. But as Holly mentioned, there still is further opportunity for feedback if you think of something after this call. I have my email at the end, so either emailing me or emailing Marty if additional things come to you afterwards. But switching over to outcome measures. So as I kind of showed at the beginning, we have done the definitions of success. We just reviewed them. And now we are going to go through the 4 key measures from the Stepping Up initiative. And for those who either didn't get a chance to look at the excuse me, the packet, or didn't get a chance to kind of look at any of the links, this is a national initiative that Whatcom actually did introduce or pass a resolution, the Stepping Up resolution in 2015, but I don't think a ton has happened from it. And it is an initiative that's specifically looking at reducing the amount of people who are in jails, who are incarcerated with serious mental illness. And they have done a lot of work in this space and come up with 4 kind of key measures to track that. And I've done a lot of looking into other organizations that you might be familiar with, including Justice Counts or Measures for Justice. And well, they have a lot of great information and details on the like once you're in kind of the legal system, the criminal legal system, and within the jail, they have a lot of kind of great information and details and measures around that, but felt that they were missing that behavioral health element, which I think is so central to the Justice Project, that it led me to kind of dig further into potential other resources, and look more into this sequential intercept model, or the SIM, for those of you who are familiar, which that spans, from the community through the criminal legal system and then reentry into the community. And then also looking into this Stepping Up initiative. And so, as I mentioned, there are links and whatnot in the packet that was sent out if you want to take some time on your own to dig into it more. But we will be talking about the 4 key measures that they recommend and digging into those today. So we'll review each measure and collect input and feedback from you all. And then at the end, any comments from folks on additional measures people feel are missing. To ground us all in where we are at in this process, what I want you to think about is, we just talked about all of those. This is what success looks like. This is how we're defining it. So if we were to be successful based on those agreed upon definitions, what outcomes would we expect to see? So that's kind of the big picture question we're asking and wanting to get at with these measures that we're going to be looking at. Okay, so, and this one we will go measure by measure and take input on, you know, for example, key measure 1 before moving on to key measure 2. So for key measure 1, that is looking at jail bookings, with the goal being to reduce the number of people with mental illness booked into jail. And one thing I want to mention before diving further into this is we've had kind of a variety of conversations on, you know, who is the population we're looking to reach and thus to measure. And, you know, is it the larger jail population or specifically those who are experiencing behavioral health issues? And what I want to say is that if we set up measures in a way that lets us disaggregate to look at the general or to look at the specific population that does have mental illness, that allows us to then also look at the population, the general jail population as a whole. So by focusing these measures on those with mental illness specifically, that enables us to both measure for that population and then also just kind of remove that level of disaggregation or that filter, if you will, to look at the general jail population. So I just wanted to kind of put that out there so that folks do keep in mind that anything that we're doing to be able to track specifically those with mental illness doesn't disable us from being able to zoom out and look at the general population that's in the jail. So jail bookings, looking at the goal being reducing the number of people with mental illness booked into jail. So what this measure tells us, it helps county leaders determine kind of the scale of the problem that they're working to address. You know, we can also use this to compare if there are disproportionate numbers of people with SMI, and SMI here being serious mental illness in jail compared to the general SMI community population. And then tracking changes to this measure can help determine if any of the new policies or practices or programs that we are doing through the Justice Project are having the desired effect of reducing jail bookings of people with mental illness. And this is not something that is going to be impacted by just one policy or program. It's going to be a combination of strategies. And, you know, when we're measuring this, it is important to note that if we're just seeing a reduction in the number of people who are booked into jail, but we're seeing an increase in, you know, the number of people ending up in emergency departments, that is not meaning that we've been effective. So just wanting to note that. And solutions that could impact this may be led by criminal justice agencies, or it could take place long before the justice system actually gets involved. So things around providing supportive housing or crisis hotlines, things like that. And so what I have done is kind of laid out, based on my read of everything, the projects that I think most directly relate to this outcome based on the projects from the implementation plan. So those would include addressing workforce shortages and behavioral health services, building systems to facilitate communication and coordination between organizations, and increasing the capacity of effective existing programs to divert people from incarceration. So if we have, you know, more behavioral health workforce and services and organizations that can coordinate and communicate better, we are, you know, thus more likely to be able to divert people from actually then being booked in jail. And then also building a 23-hour crisis relief center, which would be an opportunity to divert people from getting booked into jail. And then also continuing to make changes in court systems, which this one is, there's a handful of kind of nuances to this one that ties into this. But I am curious, one, asking for general input on this measure, what you think of it, and how it relates to being successful, as well as if you feel there are any additional projects that do kind of directly lead to a reduction in jail bookings, that I should add to this slide in the future. So I will open up the floor to any hands that might be raised for input from folks on this first key measure.
Can you see folks, Juliet? I don't think you can. I'm gonna call on folks. So
Just see that
Amber.
people raised their hands, but I can't tell who, so thank you.
Okay, I'm gonna go ahead and call on you. So Amber, you're up.
Hi, thank you. So this may come up in when we talk about recidivism, but it was just something that was coming up in my head in regards to jail bookings. And I think about I'm a part of like all these community groups, and one of the biggest things that I hear often is that people are booked and release, and they're booked and release, and maybe this again is a topic for something else, but you know, it would be interesting to see outcomes in regards to like people who are already have pending charges and they're getting rebooked. Like, is there a reduction? And so again, that could be the recidivism, but I don't know if that is a topic for like repeat offenders. Whereas I'm seeing a lot of like from the community, you know, these people they're getting released and then they're right back in 2 days later. They're getting released and with all these open pending charges. So it would be interesting to see if that is getting reduced or if that's being impacted, like, because ideally what I'm hearing is the idea is that we are helping them so that, you know, they're not just getting released back on the street, we're getting them the help that they need. So that was kind of where my head was. And again, maybe you address that. It's kind of separate than just the mental health outcome, but I know that that's been something that community members have expressed.
Yeah, great, thank you. It's a helpful point.
Right. And so, Julia, as we go through this, as people are making suggestions, if there's anything you don't understand about what they're saying, I just rely on you to make sure it's clear so you can take it back and incorporate it. Yeah, Tasha, you're up.
Regarding the measure of comparing those booked into jail with SMI versus the general public at large, I guess I'm wondering where you get your general public at large numbers from. What's the basis of it? Is that only people engaged in services that aren't in jail, or in general? Because some people have serious mental health issues, but they don't necessarily engage with the resources. Maybe they happen to have good insurance, or they have a condition, but they have been able to long-term keep it. So I just wonder when you're saying if it's not comparable, if there's a disproportionate number, but we don't like based on what number to start with, like what's the general public number and how do we measure that, or so we have a true comparison.
Yeah, and that's a great question. And what I will say is that right now in kind of the evaluation and performance measurement plan process, we are working on identifying ideally what we would like to measure. Does that mean we can measure that? No. That comes into the next phase of this, which is digging into what data sources do we have or don't have, what gaps are there, which, you know, is what you're pointing out, Tasha, that like, we would love to measure this. Can we actually measure it? You know, those are two separate questions. And so we are going to dig into that in the next phase. And there's a, you know, a large chance that we're not going to necessarily be able to measure everything that we would like to. And then, you know, can we identify proxies or other things that would get us close to that or give us a general idea? So, so just to give that kind of in terms of where we're at right now, we want to capture, you know, what ideally do we want to measure? And then the next piece is we will get into those more detailed conversations on, do we have the data? Can we measure this? So, but a good flag and something we'll look into.
Right. Barry?
Really great question from Tasha and Julia. Like really great work putting this together, as always. It's kind of similar. My questions were kind of similar to Tasha's around what is the percentage of people with serious mental illness currently or in the recent times who have been incarcerated right now? Do we have that percentage?
No, we do
We
not
don't.
have that,
Okay.
well, not concretely. And so part of this is, there's a bunch of questions that'll follow this in terms of, do we have a way of identifying who has serious mental illness or not? And
Mhm.
if we don't, what needs to be done in order to actually do that?
Okay. Yeah, serious mental illness, is that a legal term that's used to, and yeah, what falls
Yeah,
under?
so no, these are all really good questions, and something that the Stepping Up initiative has created a lot of materials around. Some of these things are going to be county dependent on how Whatcom defines, what to Whatcom is serious mental illness, and we can
Right.
use influence from other counties or states or national level, but yeah, those all need to be defined so that we have a clear definition of what exactly we're measuring and then how we actually are going to get there. So,
Mhm.
so no, I don't have
Okay.
an answer for you because it would need to be defined.
Okay. And then, when I was reviewing the material for this, um, the question kept coming up, like mental health illness, I think is a great way to is a great measure first and foremost. And then I kept asking myself, why mental health specifically? And I think you answered a lot of those questions with kind of the history about, previous like resolution in Whatcom County and also kind of the current landscape. And then I think about the demographic of incarcerated people in Whatcom County.
Mhm.
And this is a question and also like a call to action that we look at other measures that are related to race specifically. Um, because we do have completely disproportionate numbers of uh, community members of color who are incarcerated.
Yeah.
That's been the case for many, many years. And I'm also curious about those numbers and where to find them. The earliest I was able to find, or the latest I was able to find was from 2015. Um, and so I'm wondering how it, and back then those numbers were actually, honestly, pretty abysmal. So I'm wondering if one of our measures could be explicitly looking at that.
Yeah, and I think that that brings up a good point that there, we will can come up with sub measures that fall under these things. Um, and so some of those things, specifically looking at race is a good one. And so this is kind of like here at the largest zoomed out view
Yeah.
of what success looks like is, in this example, reducing the number of people with mental illness booked into jail. And then we can have sub measures that feed into that as well. So that is a nuance that I think is super important to take into consideration. Not that the data that is out there is perfect in terms of capturing race and ethnicity. I know it's often not. But I think that is definitely something that should be included. So thank you for that.
Mhm. And then
Right.
Holly
Yeah.
and Marty, if we could also somehow find that demographic information for more recent years. I know you work really closely with people within those systems, and a lot of us are part of this to kind of, basically do a better implementation and actually have like justice-centered, human-centered approach. And so I think a lot of us are missing those data, or if that could be sent over, whatever is available, even if it's just to me. I'm really curious. I love to get into the nitty-gritty, so please, if you see something, please send it to me.
Right. And we can also bring stuff, anything we can find to the April meeting. So thank you, Miriam, for asking that. Yeah. Okay. Marty, did you want to chime in on that?
We have somebody from the sheriff's office who came and joined the meeting, and I'm not sure who that is. And I don't want to totally put you on the spot, but if you do have anything to add, at any point to address these questions, feel free.
Absolutely. And this is Sheriff Tanksley. So I don't mind you putting me on the spot.
Thanks.
Yeah. So in terms of the numbers that Marion was asking about, we certainly can give this committee what we have, but we also have to be cognizant that the data which we have is self-reported. So even in a person could be biracial and report one ethnicity over another, and so on. So, but certainly we could give you what we have.
Great. Thank you, Jacob. I remember this from before. Arlene, do you have a comment or a
If you don't mind, my adding this in, we have some experience with serious mental illness. It's not scientific, which is what Miriam is going for. She wants an answer, but the truth is that in the therapy world, there is art and there is science. It's not, some things are not measurable, but you have questions to ask that get you closer to what the answer is. So, for example, you would ask the question, how do you react to certain things? And their extremeness of response tells you if it's serious. Their mild response would be a mild response or a moderate response. So you do try to measure these things, but it's not very scientific, yes.
Thank you. Thanks, Darlene. Okay, Trevor, you're up.
Thank you. The way that I'm sitting with this at the moment is that if we're specifically looking at what kind of outcomes would we be seeing or what would we want to see, if what we're targeting is a reduction in people with serious mental illness being booked into jail, then one of the important things would be developing some kind of protocol to be able to identify what serious mental illness is classified as. And then administration of that protocol to people prior to booking, which would help determine whether or not they meet criteria, for example, for serious mental illness. And if so, then I would imagine the metric that would show that is if there was a system of referral, so that whoever was assessing the person prior to their booking, if they were referring them to another facility or agency, would then be responsible for recording or reporting that somewhere as well, or it's sort of like separate from them actually going through and being processed into booking. So you could sort of have that discernment between here's the point at which the intervention happened. It was determined that they met criteria for serious mental illness, and so then they were diverted to another facility rather than being booked in.
Yeah, and you're getting at a lot of the follow-on questions to this and things that have to be discussed and decided upon in terms of how you would capture this, and you would want a tool to be able to do that assessment and all of that. So 100% on the right track there.
Right. So let's hear from, I think actually Pamela was next, then Dan, then Dean, then Hannah. So Pam, you're up next.
So I suppose mine is probably pretty in the weeds. My thoughts, response to this in a recent personal interaction with the system with a family member where they were in the emergency room and ended up in jail for the night and now have felony charges. So serious mental illness was involved, an ER was involved, and the outcome was jail, unfortunately, which didn't make a lot of sense. But so like, do we measure that from the perspective of the ER and their reporting of how many folks with serious mental illness were referred to services versus ended up with incarceration, and or does it come from the legal side of that scenario where if they pick somebody up from an ER that has serious mental illness, is there some way to track that they ended up in jail? And another thing that occurs to me is part of the scenario that happened in my personal life was that the individual went to jail overnight and was released to a clinic for mental health services. And when they arrived at that clinic, were told, because there was a history, we're not willing to accept this person as a patient in our facility. So there were all kinds of levels of the ball being dropped, and the person, a 71-year-old female with severe mental illness, going to jail overnight and now felony charges. So it wasn't in our community, so that's a good thing. But yeah, super sad scenario that really did not need to kind of end that way. And upon showing up at the ER with a history of having been in that ER, there seemed to be a plan by the staff at the ER and the community to get that person straight to jail versus tolerating any misbehavior, if you will, from that mentally ill individual. So lots of area there, and I wonder how we can look at that in our community and make sure that we're measuring or capturing the agencies that are alternatives to going to jail, how accessible, because this always, generally happens at 3 a.m. or definitely not at a convenient hour. Yeah, so this person was actually driven to a clinic at like 3 a.m. and was considered but not taken in for services and ended up just going home. So what a weird scenario. But yeah, so capturing like what services are available in our community at what times. I think it will eventually need to get pretty specific, I guess is my point. And a lot of different agency involved to capture what's currently unfolding in our community in regards to people with severe mental illness ending up in jail, when it's really obvious that that wasn't a great fit for anybody. I think the jail really wanted to deal with that either. So that's the comment. Thank you for listening.
Yeah, thank you for sharing. I think you point out something to take a note for sub-measures in terms of capturing the other policies or programs or agencies that are at play here that, right, just because someone doesn't go to jail doesn't mean that it was a success. So there's a lot of other services that are needed to make this a successful, to make reducing the number of people with mental illness booked into jail actually be success. So.
Okay, Dan, you're up.
Yeah, thanks. Good afternoon, everyone. So I just have a few thoughts on this. The way that the question or the goal is stated here, it says reducing the number of people with mental illness booked into jail. So these are all pre-trial. They've been charged, but they're not convicted. They're not serving their sentence. They're in the jail, or they've been booked and released, which we've talked about here a little bit. So I just want the group to perhaps consider competency restoration up to and including True Blood decision that's been made, and True Blood housing finances that have, can be flowing into the community to provide for housing services. And I also want to, I'm looking at the goal, and I'm thinking about the LEAD program, the Law Enforcement Assisted Diversion program, in terms of helping to prevent people from getting booked into the jail incarceral system. So I want us to have just a bit of a roadmap when it comes to existing services and existing programs, and just thinking through the challenges. This is a big topic. Competency restoration includes Western State, Eastern State Hospital, and so there's a couple other smaller providers where the path for people to go to those institutions, and that's what they are, is long, it's arduous, and it just results in them going back into the court system. So I just want us to be like clear-eyed and thinking about what all this really means. So, and I'll pause there. Thank you. Appreciate it.
Yeah, thank you.
Great, thank you. Okay, Jean, go ahead.
So I'm recalling as we're talking through this, that when the county got involved in the Stepping Up project, it was a national project very much focused on mental illness. And so it would not have necessarily identified reducing the number of people with substance use disorder from being booked into the jail. And realizing we need to make sure we aren't overlooking that population or the population that carries both diagnoses or issues when we're defining these measures. Because I think in our community, and as many others, you know, crimes not motivated by poverty, but crimes motivated by a substance use disorder are an important consideration. And so I just would propose that we modify that goal to include substance use disorder as well as mental illness.
I've been thinking exactly the same thing through this conversation, Dean. The way that we've talked about it in the implementation plan throughout is behavioral health disorders or issues as a combine both mental health and substance use disorder. And I've been wondering if in these goals, these measures, we might want to refer to behavioral health disorders instead of just mental illness.
Yeah, we can,
Or I think calling out both, just to make sure people are clear there, both issues need to be addressed and they have somewhat different sort of conditions that result in interaction with the legal system.
Yeah.
Great feedback. Julia?
And just for sake of time,
Yeah. How do you want to handle this? Should we pick up these two comments and then move on?
Sure. Yeah. So 2 more comments on this, and as I mentioned, there's my inbox is open for additional feedback. But yeah, let's go ahead and do 2 more and then move on to the next.
Great. Go ahead, Hannah.
I'll try and be really quick. Dean, I think, made a really great point that there is, behavioral health as a whole, and then we also need to look at those subpopulations, those with SMI, those with just mental illness, and then those with just substance use and those with co-occurring disorders. And the path to treatment for them looks very different, and our solutions will be very different. Some things that we've talked about for like diversion programs aren't really being designed for individuals with SMI as much as they are for individuals with just kind of like minor mental illness. So just need to be mindful of those different populations. And then also I just wanted to speak on the SMI definition that we use at the jail for serious mental illness. When we're prioritizing who we're working with, we're looking at, we use the SAMHSA, Substance Abuse Mental Health Services Agency, something, that body's definition of serious mental illness, and we try and modify it so it's on the surface individuals with a psychotic disorder and individuals with bipolar disorder, and then past that we also include people who have significant functional impairments due to their mental illness. So it's not just based on their diagnosis, it's based on functional impairment as well. And then we actually have some data based on those individuals as with SMI compared to those individuals who are just general population booking and releasing. So if anybody wants them, let me know.
No, that'll be great. Kind of in the next step of this, when we actually
absolutely
need to, how are we, and by we I mean Whatcom, defining SMI. So
exactly. Yep.
Awesome. Thank you, Hannah.
Tasha, are you okay if we just move on? I know Shreyan's down. Awesome. Thank you. Okay, that was fabulous. Let's move on. Next measure.
Yeah, great. Thank you all. Super helpful. For key measure 2, it's looking at jail length of stay, with the goal being shortening length of stay for people with mental illnesses in jail. And what does this measure tell us? It helps determine the amount of resources that are being used by these individuals. Comparing this number to the, and sorry, these acronyms, AOLS, average length of stay of the non-SMI population can illuminate whether one population is more likely to remain in jail longer than the other, which at the national level, when we look at data, is the case that those with SMI do typically remain in jail longer. Tracking changes to this measure can help counties determine if new jail and court policies, practices, and programs, as well as community-based solutions, such as availability of psychiatric beds or outpatient treatment options, are having the desired effect of getting people with SMI out of jails more quickly. Once again, and you know, this is the case in all of these measures, it's many factors that impact this. In this case, so many factors can impact jail length of stay, regardless of a person's charges, criminal history, or mental health status, but often these factors are exacerbated by a person's mental illness. And like I was saying, there's so many opportunities to affect change at the pretrial stage. So counties, you know, as Whatcom does, often uses a combination of strategies to have an impact at this point. And you know, for me, for jail length of stay, you know, Project 8, building a new jail and behavioral health treatment center, ties into that, as well as expediting access to competency restoration services. But super interested in any feedback from folks who are more deeply involved in each of these projects, if you feel that that another project should be added to this visual here. So I will pass it over to folks on the line for inputs on this one.
Okay, floor is open. Yeah, Dan, go ahead.
Yeah, can I just ask a clarifying question, Julia? What are you, when you going back to that other slide there, when you said behavioral, let's see, behavioral health treatment center, are you referring to the 23-hour treatment center, or the BCC, or the Ann Deacon Center, or all of the above?
No, so the 23-hour crisis relief center is the one above that in terms of Project 7. So I was referring to the BCC specifically.
Okay. All right. Thanks for clarifying. Appreciate it.
Yeah, Praneet, go ahead.
I just had a question. Could you go back to the last slide? For number 13, continue to make changes in court systems. Do we have any data on the, I guess, minimum length of stay for individuals in awaiting trial at the jail? I wanted to see if we have any like information how long it takes for like the average case to go through. Because I've heard it takes months and possibly years. There's a lot of cases being delayed and stuff like that. So I'm really curious about that data and how we can better the courts to remove the length of stay for a lot of people. Yeah, that's it.
Yeah. There are going to be some people on the line who might actually be able to speak to that in detail more than I am. And I'm seeing more people raise their hands, so I'm not sure if that's in response to someone who would like to answer that.
Peter, are you responding to that question? Or do you have a different comment?
Only somewhat. Let's see, let me clear my screen here. Can number 13 continue to make changes in court system would be have a direct impact on jail length of stay. So many of the people in our system, as the last speaker was referring to, are there because our throughput in the courts is constrained by a number of things that need to be ironed out. So
great, I'll add that.
And folks, if you can remember, it helps me if you have a direct response to a question or a clarification. Do you remember this sign? Like Stark, I just saw you a second ago. Did you have a direct response to this? Or you have a new comment? Otherwise, we're going to move on. And you're muted.
Sorry about that. Yeah, I do have a direct response, and my direct response is that there's a ton of factors that govern how long people remain in jail before their case is resolved. Certainly, one of the main factors is the seriousness of the offense. Murder cases tend to take a great deal of time before they can be worked up and prepared. Anytime there are mental health issues in a case, it can take a lot of time because forensic psychiatrists and psychologists have to be retained to go to work on the individual, and that takes time. I would just say there's no set answer. I think that the sheriff probably has statistics on what the average length of stay is in the jail, but that doesn't by any stretch address an individual case, because there are people in and out of the jail for a matter of days, and there are people that sit there for years. It's really all over the place. I will tell you that with respect to that box 13 that I think was asked about, is that the prosecutor's office, the public defender's office, and the courts meet constantly. We have a quarterly roundtable and talk about changes that we can make in the system constantly, not necessarily directly addressing jail length of stay, but the overall system reform that ultimately leads to shorter lengths of stay in the jail. And so, rest assured that the parties that are involved in this process already have modification systems in place, and which isn't to say that there's not other ideas, and there are other ideas that can come from other sources, but we work on reform in the courtroom constantly.
Great, thank you. Miriam, you had your hand up earlier, but just chime in if you still want to speak. Otherwise, we'll hear from Tasha's next. Tasha.
Yeah, regarding where you're going to, I think that number 5 might be a good one here, because I think sometimes the breakdown in communication between organizations, we've talked about this ad nauseum, I think, before, that none of our reporting systems talk to each other. And so sometimes things get lost going between one organization to the next. Obviously, we have to work around, especially relating to mental health issues, some HIPAA stuff, but I think if we built up a good communication system between all of our organizations, that would help as well. So I think number 5 has a could have an impact on length of stay.
Awesome, thank you.
Rob?
I would, I'm gonna echo what Tasha said. I'm also gonna echo what Dean said in the previous slide. Just really looking at maybe behavioral health approach rather than just mental health.
Yeah, I've jotted that down for sure, so thank you.
Thanks. Tank?
Yeah, so I apologize for being off camera, but our average length of stay right now is about 19 days. And we do have reports for 2023 and 2024 that has the ethnicity and the racial demographics. It also has how many bookings by agency, and the offenses and so on. So I've already sent an email to Chief Erickson to provide that to this committee. It also tells you the jail population breakdown as far as the charges, how many people that we have on electronic home detention, how many people we have in custody work crew, and so on. So it's fairly detailed, and we'll get that out in the next couple of days.
Fantastic, thank you. Okay, Tasha?
Sheriff Tank, is that, when you say 19 days, is that pre-trial or just a booking and releasing, waiting for court? Or is that like also being convicted and they have like a 10-day sentence to serve? Is that incorporated into that 19 days?
Right. If they're serving a sentence, those folks wouldn't be included, but it would be everyone else.
Okay.
Tasha, that was a good question.
Great. Any other thoughts that folks have on the key measure 2? Okay, Julia, let's do the next one.
Great. Thank you again, everyone. For key measure 3, we're looking at connections to treatment. So the goal being increasing connections to treatment once people with mental illness are released from jail. And, once again, just wanting to make clear that if we set up ways to measure increasing connections to treatment specifically for people with mental illness, we will be able to measure and track, for those as well who don't have mental illness. So it's not precluding that, but it's just specifically making sure we have a way to measure it for those who do have mental illness and, as noted, behavioral health disorders and issues. So this measure tells us, to what extent people are getting the services they need to be successful in the community, and will help, what can determine if, once again, new jail and community-based policies, practices, and programs are working to have the desired effect. Once again, no, this is not, just one county agency that can do this and ensure that people are connected to treatment and services that they need once released. So key parties can include, anyone from corrections and court staff, like probation, but also case managers, treatment providers, housing and other human services, employment services, community supervision, and others. And, as we were getting at, I think with what Tasha was saying with number 5, looking at coordination, right? Like in communication, often a person's recovery requires all parties to work collaboratively, both while a person is in jail custody and also after she or they is provide a holistic and continuous approach, providing treatment, services, and supports. Which makes me think that I should also add number 5 to this one. But we have number 9 here. So identifying what additional facilities are needed to support people with behavioral health and SUD issues at risk of incarceration. We have number 10, ensuring people leaving detention and treatment facilities have transportation to a safe destination. Number 11, looking at bolstering reentry services. Number 12, looking at maintaining and expanding supportive housing programs. And number 15, looking at advocating for a state waiver to allow use of Medicaid funds. So I will pass it over for kind of same thing with the general thoughts on this overall measure, as well as any additional projects that I should link to this one directly.
Great. Dean?
Here again, I think, as with the first 2, I think for this measure and the recidivism, we need to broaden the population to include SUD, folks with SUD issues and dual diagnosis folks. And also, I think connections to treatment, Project 5, I think very much needs to be considered a contributor to this particular outcome.
Great, thank you.
All right, Miriam?
To add the importance of making sure that we look at our populations of color. I'm really excited to get into the report that Sheriff Tank mentioned, because I think it's going to be really helpful in helping us find other ways to establish key measures, and even probably, I mean, there's a lot of resource out there, and how to even create interventions that are racially competent, for lack of a better term, right now. But so that's one thing. And then also, what I had a conversation this week, and I remember saying, like, it would be really awesome if we had a my chart, but for the justice system, that was kind of where everyone who provides services could just have access. It's kind of seeing this as like a responding to a human being's needs. And I know someone mentioned the LEAD program earlier, and kind of that as almost like a model of kind of tracking people along and kind of following up with folks. And I think if we could do that at a bigger scale, or use that model and kind of like expand it in this for this particular justice project, it'd be really awesome. Yeah.
Yeah, and when you say that, are you thinking of like being able to track someone from kind of like, or follow them, I should say, like from start to finish in terms of their journey through the criminal justice system, you know, if they're diverted and connected to treatment? Is that what you are getting at?
Yes, and I think more for the people providing the services,
Mm,
so they have a better understanding, just better background. It stops being about, um, I think one person gave an example of this person had a history of mental illness and went to the ER and then was sent to jail.
yeah.
You know, so if there's some kind of I guess a place that's everything's tracked, and you kind of have like, okay, this is kind of the way we have to respond when we have a history of mental illness or behavioral stuff, instead of kind of going from one thing to like, okay, well, you know, this person is being um I saw something recently of a woman who went to the ER and then was being verbally abusive, and was just arrested and just sent to jail. She was clearly having some mental health needs that were not addressed. She was just sent to jail. And yes, she went to ER and did yell at people. And also she had needs. So these are the kinds of things I'm thinking about of like, okay, if we know someone, okay, if you're able to identify people and say, okay, this person has a history, how do we make sure that we address the need of the person before we just think about like sending them to be incarcerated? So it's both ends.
Thank you.
Thank you. Okay, Hannah.
Yeah, I think potentially point 13, making changes in court systems to expand on our like diversion programs, mental health court, recovery court, those options. And then also number 4, addressing the workforce shortages. So then we could have more treatment options to send people to.
Yeah. I will add those.
Oh, did I miss something there? Julia, were you
saying I would add those connections in this visual, in this graphic?
excellent? Okay, Peter, you're up.
Oh, my comment was already actually covered. 4, 5, and 13, I think you could argue should be added. And to Miriam's point, number 5, that I think to a great degree, that's what number 5 is very much about. We have a very siloed behavioral health system here in Whatcom County. What we saw in Tennessee was one group called Mental Health Co-op that dealt with the population we're talking about here. And they were able to have handoffs that our system simply cannot provide. So just wanted to point that out. Thank you.
So Julia, it's we can go a little bit over, I think, and still get everything done that we need to do today. So how would you like to focus our, let's say if we can go another 10, 12 minutes?
Want to switch then to recidivism, because I know this is a big one.
Great.
But I can't tell, you know, were there any other hands?
Nope, I think we're good.
Okay, so this is the final measure that you know, comes from the Stepping Up initiative as a, you know, high level measure for outcomes, and it's recidivism, and with the goal being to lower recidivism rates for people with mental illness, also generally, but making sure that we're able to track it for those with mental illness. So this measure tells us it can help determine if people who have SMI are successful upon release from jail. And comparing these rates to those of the non-SMI population can illuminate whether release and supervision strategies are negatively impacting people with SMI. And once again, it can help Whatcom track if new release and supervision policies or practices and programs, as well as improvements or additions to community-based resources, are having the desired effect of keeping people with SMI from coming back to jail. And as with the 3 other measures, there's no one agency that's completely responsible for reducing this. Efforts to reduce recidivism should start, as soon as individuals are booked into the jail and continue while they're in the community, whether they are on supervision or not. There are many projects that impact recidivism. So, we have 4, 5, and 6, which are all looking at behavioral health services and capacity, looking at building a 23-hour crisis relief center, as well as identifying what additional facilities are needed to support people with behavioral health and substance use disorder issues. And then, a lot around 10, 11, and 12. So looking to make sure that people have the resources and support they need when leaving the jail. So same question again, any general comments on the measure of recidivism as a way to look at success, and then also any additional projects from the implementation plan that I should link to it.
Fantastic. Okay, Hannah.
Yeah, I think potentially number 13 and 14, 13 based on, getting people the right kind of legal support and behavioral health services with like mental health court and recovery court, but also 14 expanding on that maybe to not necessarily expedite the competency restoration services, but like expanding it, because a lot of times people will be referred for a competency evaluation, they go to restoration, and then the next evaluation says that they are not restorable, and then their charges just get dismissed. So what other options do we have to address that competency piece so that they're not just going out into the community, getting the same charge, coming back, going through the whole process again just to have the charge dismissed because they're not restorable? So expanding on that, where maybe we have outpatient competency restoration services or something to address that need.
Thank you.
Okay. Peter?
I would argue that number 8 is should be included in this. One of the measures we're going to be looking at in the behavioral care center as part of the new jail is the recidivism rate of the individuals who are being treated there. So that is one of the great promises of the BCC, is that we'll be able to treat folks there for their behavioral health challenges, both mental health and drug addiction, and see less of them in the jail.
Here. Okay, Dan.
Okay, thanks. Yeah, I just wanted to let the group know that on the behavioral health committee for the incarceration prevention and reduction task force, there's a group that have volunteered to sign up for reentry and diversion recommendations to the broader task force, and it includes an EMS member, defense, one of the top defense public defenders, and many others that you would like. If you saw the list, I can send the list to the group, but basically I just wanted to let the group know that we're looking at all this stuff on the incarceration prevention reduction task force side of things, and I just don't want there to be a bunch of overlap when it comes to the work. I kind of want to just make sure that we are all aware of who's doing what, and so just wanted to provide that for you. Thanks.
Great, thank you, Dan.
Okay, Amber?
Yeah, and this, Dan, might fall right under what you were just talking about. But like one thing when I think about recidivism and I think about the courts that I see clients who they're at the probation level, like Whatcom County level, right? So they'll keep reoffending until they get a charge maybe at a superior court. Now they're willing to go to inpatient, but they weren't willing when they were just like on county probation, right? Because the consequence wasn't worth it at that point. But now when they get into superior court, now they're considering inpatient. And so that's just kind of what's like going through my head when I think about the last number 3, and then also this recidivism and like the consequences at that aligns with like the charge that they now have, right? Because like lower charges mean like a lower consequence. So just sort of, I don't know what I'm trying to say, but I feel like that does play a role in their repeat offense, like what risk they have at that point, what charges they're facing.
And just to add that, recidivism is also another thing. Connections to treatment and recidivism are things that will need to be defined for us to measure it and measure it how it's meaningful for Whatcom. So when we say connections to treatment, what does that actually mean? And when we say recidivism, what does that mean? Because there's many elements that go into that. And those have not yet been defined and are something that are going to need to be defined for the county.
Okay, Miriam.
Back to what Peter said about number 8.
Mhm.
I'd like to add that I don't believe building a new jail does anything for I don't think it does anything for keeping people out of jail to build a new jail, but I do think building a behavioral health center, treatment center probably does more to keep people out of jail than to build a jail. So I wanted to say maybe if we're adding that part, could we be specific about the behavioral health treatment center part of things? Because I think if you want to keep people out of jail, having a jail doesn't really do anything to keep people out of jail. But since we're in this space and this is the conversation we're having, I think centering the servicing the people versus incarcerating the people do more for keeping people out of jail. So I just wanted to say that and name that because I know that's one of the many things I will be talking about in depth.
Yeah, and it's interesting you bring that up. I actually just asked the other day if there was, because part of building a new jail under number 8 is, really making sure that it meets the needs of the people that are incarcerated, and how can it be built in a trauma-informed way. And I was asking if there is any data out there yet that shows that if you build a jail that is more trauma-informed and is kind of wanting to rehabilitate and not just be a stone concrete box, if you see any linkage to us to reduce recidivism. And it's we don't have data on that yet.
Okay.
But I was asking the same thing, so I think it is a fair point, and it's something I'm curious about in terms of actually what goes into building a new jail. Just by itself, building a new jail, no, but if they're building it in a way that does have kind of all this trauma-informed approach, I am curious if it does lead to a reduction.
Yeah.
Not too early as it's a newer thing, but yeah, no,
Right.
I'm yeah.
Great, thanks. Tasha?
Yeah, that's a good debate to have. And I think recidivism can be pushed into all of these. We can look at recidivism and the building of a health center and all the other services and be trying to measure if they're, one thing is, when we think about recidivism, we think about them just going back into jail or being charged with another crime, but are they just rotating in and out of the different services and never having an improvement made? So when I think of recidivism, I don't think of just in and out of the criminal justice recidivism, but are we having long-term impacts on improving mental health overall? And so, I think that's one of the key things we're trying to also determine separate from the jail is all these different services that we are trying to support behavioral health, addiction, et cetera. Are they having the impact as well? Are we seeing a reduction in the use of the intent is we've helped you get better. Are you staying better? And are we being successful in the long term of that? So when I think of recidivism, I think it across the entire spectrum of all the services, not just the criminal justice system.
Yeah, that's going to be important to discuss when we decide upon, what do we actually mean when we say recidivism for Whatcom County.
Oh, you're muted.
I just wanted to, again, mention that in number 8, I think what's being referred to there is the behavioral care center, that element of the overall levy or whatever it's called, that involves a portion of the constructed facility that would be devoted to behavioral care. And I also want to just give a plug for some work that's underway right now that Hannah Fisk has been doing, looking at the issues around, what would be the functions of behavioral health treatment in relation to being in or out of custody. And I know she's not quite ready yet to come forward with, the work she's doing, but stay tuned because I think she's done some significant work around those issues related to treatment in and out of custody.
Thank you, Dean. Holly, are there other hands on this, or can I, just for sake of time, switch to asking like a broader question, which is beyond these 4 high-level outcome measures, are there ones that people feel are missing?
Yeah, we just got one more comment from Mary. Go ahead, Mary.
What I was going to bring up is that it's kind of in the broader sense. So it kind of answers I think it answers your question, Julia, because this is something I've been thinking about and wondering when we'll talk about. In terms of this, I think about policing specifically. And I don't know where it fits into, I don't know whether it fits into outcomes or projects or how we would oversee this or start to look at the data. But I know that the Whatcom Racial Equity Commission is interested in looking at how policing is happening in the community. I think one of the reasons the commission even came to fruition was a response to the community asking questions about policing. And so I think about, so far, all the discussions we've had has not addressed that. And when we think about people who are incarcerated, arrested for whatever reason, policing plays a huge part in that. And, I'm not going to pretend to be very knowledgeable about everything justice system related. I'm learning as we go. But one of the things I'm finding out, and it makes sense, it's very like common sense when you think about it, is that the police, there's no real way of tracking crime. You can't really know that crime is happening. You just kind of stumble upon it. And it really is like finding out about a crime is a reflection of who you're policing, not necessarily of who is actually committing a lot of crime. And so I was wondering if that could be some kind of a measure. I don't know what it looks like. I'm curious to hear from the experts in the room and folks with, just lived experience.
Yeah, I have a follow-up question to that, that is in no way wanting to diminish the importance of that, because I think that point is really important. But for those who, were instrumental in putting together the implementation plan, like, does policing fall into the scope of the Justice Project implementation plan? I'm coming at that from the lens of like, that's what I'm looking at from an evaluation and performance measurement plan. So I'd love to hear from people who were involved in the implementation plan coming together and how you see policing as within the scope of it or not.
Yeah, Tasha?
Well, I can't really speak to the justice implementation plan and how these 15, I wasn't on the original committees that came up with these 15 points of that. When I'm hearing Miriam kind of has been the long-term discussion in law enforcement. How do you measure success of just law enforcement? Because you can't measure the crimes that didn't happen because we happened to be there, because we didn't know they didn't happen. And we didn't know if it was because of us or not because of us. The majority, I mean, you can measure arrests that were made as a result of a 911 call being submitted to dispatch, and you can measure which were self-initiated, like what did I happen to see that I just done random patrol. So there are you can distinguish between 911 initiated arrests and self-initiated arrests. So you could look at that. That would just be through reporting systems from the criminal justice agencies.
Thanks. Yeah, Dean?
Just to say that the needs assessment as one of its tools used the sequential intercept model, and certainly that point at which there is police contact with an individual is one of the important intercepts that could be a point at which a person is diverted from further going down the path in the criminal legal system. And so, while I don't think there's been any projects identified related to that, certainly the overall needs assessment, I think, was looking at policing as an important step in the process by which people get into the criminal legal system.
Thanks. Dan?
Yeah, I'm trying to answer both Miriam's and Julia's question here. Julia, you were asking for kind of a broad, like, what are we missing, kind of basically. And then Miriam, you were asking about, policing data and things like that. So what Dean just brought up, the sequential intercept model, we've on the task force, we've been using that for I think 9 years, 8 or 9 years, somewhere in there. And when we first started using it, it was like steps like 1 through 5. And just so this group knows what I'm talking about here, it's an assessment of like things that we have in the community, programs, resources, partners, things that we have some of, but we need more of, and then things that we just don't have. So it's kind of 3 different levels of an assessment of what we have in Bellingham and Whatcom County. I think that's that sequential intercept model, that's a mouthful, would be a good tool for us to look at here on this committee, so we can get an assessment of the work that's been done and the things that we need to still do. And then Miriam, to answer your question, or to kind of not answer it, but to try to address it, the city came up with an alternate response team for responses to behavioral health calls. So that way we don't send a police officer with a badge and a gun to a situation that just there's a person that needs help and they might need a ride to the hospital, or just maybe someone to talk to, or that kind of thing. And so we came up with that about, I think, 3 years ago. And then the sheriff's office came up with a co-responder model, which is, it's just different because of the geography of Whatcom County is so big. So they have a co-responder model with a deputy and I think it's a DCR, or designated crisis responder, that goes out with the deputy. And so I guess what I'm trying to say here is the shift in how the responses are to folks that are in crisis, whether it's substance use disorder or mental health issues, has really changed over the course of the last, I would say, decade, but it really is transformed in the last 5 years. And so I think that we're going in the right direction. Do we have more work to do? Absolutely, 100% more. But we're getting there. So I just wanted to put that out to the group. I do think that the sequential intercept model, should be distributed amongst this group, so we at least have that as a tool to understand. So we're on the kind of the same page that the task force is on. And I'll end there. Thank you.
Thank you. That's all super helpful.
Julia, did you want to, what would you like to ask the group now? You said you kind of had a bigger frame you'd like to.
My bigger question is really when we go and zoom out here, but it's not doing that. Here we go. You know, when we look at this bigger picture view of, you know, we have the implementation plan and its projects, which are in the first two. We have our definitions of success, and then for outcomes, I just suggested 4 that are based on, you know, this national stepping up initiative. Are there any beyond those 4 that people feel like are missing? And I'm talking at a high level here, because a lot of some of the things we've talked about can be sub measures under those 4, but at a high level, is there anything that you feel kind of jail bookings, length of jail stay, connections to treatment, and recidivism don't capture that are central to the success of the implementation plan?
So I'm going to hear from Tasha. I also want to recognize we've run a little over. It's almost 15 minutes before the hour. So this seems like a really good thing for all of us to think about before our next meeting in April as well. And Marty, why don't you start thinking about how we're going to bring this thing home? Tasha, go ahead.
I'll keep it really short, and I think I brought it up last time. Success, you broke the success into different categories, which I appreciate, and they're great. I think overall, we have to have the overall arching success at a community level, where we bring in our victims feeling safer. Is the community a whole have a better, you know, at least a perception that the community is safer, etc. So I think I don't know how you measure that, but it's something, you know, we're doing a lot of the success on the individual level, but we have to keep the holistic community level in mind as well.
Yeah, and what you're getting at is that population accountability versus the performance accountability. And so 100%, it's what comes right after this. If there was room on this slide to have another arrow, it would point to exactly what you're talking about. So great point, and something that, yeah, when we do the next zoom out, will definitely be what we'll be talking about. So thank you, Tasha.
Thanks. Miriam?
Love to see us address very directly and intentionally the fact that we have a small percentage of people of color in Whatcom County, but they make up a huge percentage of incarcerated people and people who are dealing with the justice system in Whatcom County.
Yeah, the Stepping Up initiative has a handful of resources on bringing racial equity into the framework. So I'll dig more into those in advance of the next meeting, so that I can, you know, come more prepared to talk about concrete ways we can do that.
Thank you.
Thanks. Awesome. Okay, Julia, any closing comments? So we'll all think about this some more. Awesome, awesome work.
My email, which will get sent out. If you think of further things, please feel free. My inbox is open. I'm so thankful for all of your feedback. So, and worst comes worst, just email Marty and she can get it to me. So thank you, everyone.
Great. Yay. Thank you so much. It's so great to have you here. Okay, Marty, what do you think? Should we pop up the last little couple slides and in the next 4 minutes kind of crank some stuff out? And you're muted. There you
Sorry.
go.
Okay, we can whip through this. These are really just some updates on these next slides. So I just want you to know, with regard to our work that's related to stakeholder engagement with the jail and behavioral care center design process, that the county has contracted with a consultant group called STV. They're called our owner's representative. And they have, we want to be in close coordination with them on stakeholder engagement. Said this at the last meeting, but I'm just saying it again. And we are working to do that coordination with them. That will affect our timing on the jail inmate focus groups and survey, and also any public engagement, public forum opportunities. With regard to the jail inmate focus groups and survey, we, Dean and I are going to be talking to the Institutional Review Board, because the focus groups and survey interact with vulnerable population. We need to go through an IRB review. And so we'll be talking with them tomorrow. And we've submitted that IRB request and also a project funding request so that we can do the work and have people involved get paid. On the next slide, I wanted to just make sure you all saw the Justice Project website, which has been updated a little bit more since the last time we showed it at this meeting. And let me see if it will click over directly to it here. Are you see?
How about if we just
Wanna show
encourage
it here?
people to go? Yeah.
Yeah. So this is the website. Again, you click here to track progress, and this is the page. Does anybody have any feedback on this web page here that you want to share real quick? Or if you have more than a quick comment, we can just take it via email. Hopefully it's looking okay to you all.
Great. I'm seeing some
And
notes.
then
Thank you.
going back to the communications here. Other things we're doing, we've got a press release approved, and that will go out next week, telling people about the web page and what's on there, the Justice Project website, and these reports. We also are going to be sending out social media announcements of the website, and that'll start next week. There are, and we hope you will share them with your networks. And a few other social media ideas that have been raised would involve you. And well, one is that we could pull meaningful segments from the recordings of these meetings and quotes from these meetings and get those out on social media. Another is to highlight any of you who would be open to being highlighted, and we would have a little headshot of you and something. It would be kind of like a meet the J-pop. You know, why did you join this committee, and maybe a little bit about yourself. Very short profiles is another idea. If you are interested, we'll ask you if you're interested in being one of those people, and talk a little bit more about that on the April 17th meeting. Also, at each of these meetings, we'd love to make some time to hear about projects that you have that are work you're doing that's related to the Justice Project that you think would be of interest and should be shared out. And we'd like to hear any other ideas you have. Now I'm going to just turn it over to Dan for a little update here on where things stand with the Dwalach Wellness Center tour that we've been working on getting set up for you. This was raised at the last meeting, and we've moved forward on getting the logistics figured out.
Thank you. Appreciate it. Hey, Marty, do you have the dates? I think I've got like
Yeah,
April 4th.
Uh-huh. So April 4th, for those of you who filled out the doodle, April 4th was the top date. There were a couple people who wanted to participate who couldn't make April 4th, but could make April 10th. So we were thinking of doing 2 tours.
Yeah, we're gonna have to do 2. That's fine. I have a note into the people that coordinate the tours down at the clinic, and just so folks understand this is the recovery clinic, and it also does way more than that: medical, dental, NA, AA, childcare, the whole everything. It's a trauma-informed design clinic, and it's off of Highway 20 just before you get to Anacortes. So it's about a 40-minute drive to go down there. We're gonna have to coordinate transportation and figure out probably county vans. The cities, because this is a county-led project, it's gonna have to be county transportation, but we'll get that all figured out. But it is coming up pretty quick here, so I'm trying to get this all like the logistics just kind of situated. So the clinic has done an amazing job in providing treatment services with Suboxone and methadone to folks, and 70% of the folks that go to this clinic are not tribal members. They're throughout multiple counties, including the one that we are in right now. And they have a mobile medical unit right now at 2030 Division Street. That's next to the work center and kind of behind the Ann Deacon Center for Hope. They do amazing work. I'm just super impressed with everything that they do, and they're a great partner. So I'm hoping that folks from this committee can consider coming on one of the tour dates that will be confirmed here shortly. We're just kind of, like I said, we're still kind of working on that. But it's really, I think, informative in terms of like, what does trauma-informed design and care, patient-forward design and care look like? And they do it. And so I'm hopeful that people will be receptive to coming down, joining me. I'll be on both tours. It takes about an hour and a half. But yeah, anyway, that's what I know so far.
And we'll watch your emails for those announcements of those tours. That's how we'll pull it together.
Yeah,
Thanks,
of course, yeah, I think I'm gonna like route everything through Marty. I think at this point would make most sense if that's okay.
Totally.
Okay, yeah, okay.
All right. And then,
yeah, thank you.
Holly, were you wanting to say something?
Only that I need to close at right at 4.
Yes.
So.
Okay. And so before going on, let me just ask, we had a few members of the public here who are people who aren't J-pop members and may have something to say that you haven't had a chance to say. So let's make a little public comment period here, and we'll cover other stuff if we have time after that.
Great, thanks. So the floor is open to any member of the public who would like to speak at this time.
Just raise your hand if you do.
Okay, hearing none, then let's go ahead and finish off these last little bits of business. Thanks, Marty.
Okay, I just wanted to see if anybody has a strong preference over having a summer recess, that is no J-pop meeting, in July or August. It'll be one of those months. If you have a strong preference, say so. Tasha.
I would prefer not to have a meeting in July.
Okay.
I'd rather have it in August.
Let's do this. Raise your real hand or your virtual hand if you would rather not have a meeting in July. And then I'll ask about August. 1, 3, 4. Okay. And who would rather not have a meeting in August? Stark, are you August or July?
Sorry, July.
Okay, so we're about tied. All right, well, we'll figure that out. And we'll work with the co-chairs and figure out that plan and let you know as the remaining meeting dates for the year as soon as we get that figured out. Thank you. Comment, and that was it for me.
Well, we have the last slide, right, with the next meeting? Marty?
Oops. Where is it?
So our next meeting will be in April.
It just jumped. Yep.
Are you going to reshare that slide? Marty, are you going to put up the slide about our last meeting?
Got it.
Okay, great. So just scenes from our scenes ahead. So our next meeting is going to be in person. It'll be happening on April 17th, 2 to 4 at the Wecom Education Center, 511 East Holly Street. So great. Marty did a lot of looking around to find us a spot. So thank you, Marty, for doing that. And we'll do continued discussion of the Justice Project performance measurement, all of this that we're working on, so great. An update on the jail BCC, and then that opportunity to provide input for the IPRTF annual report and any recommendations for implementation plan updates. So this is a really important pressure point for us as part of the IPRTF and also our connection to Whatcom County Council. So it should be a good one. Looking forward to seeing everybody in person. And unless there's any further comments, yeah, I believe we are adjourned.
Thank you
Thank you,
all.
everybody.
Everyone.
Awesome meeting.
Will you be emailing out Julia's email to everybody?
Let's do it. And